Hello, and welcome to POMA Does, a podcast produced by the Pennsylvania Osteopathic Medical Association. We provide a voice for osteopathic medicine and share insights on issues important to osteopathic physicians, residents, and students, as well as those who embrace the osteopathic philosophy. POMA's mission is to promote the distinctive philosophy and practice of osteopathic medicine for our patients, our members, and the communities we serve. Thanks for tuning in.
Hello and welcome to the latest episode of POMA Does podcast sponsored by the Pennsylvania Osteopathic Medical Association. I'm Syed Arian. I'm a family medicine resident. I went to PCOM class of 2023. I'm a member of the digital committee of POMA. Today we're going to explore the topic of AI in medicine. I'm privileged to be joined by Dr. Michelle Thompson. She is the Vice President of Medical Staff at UPMC, Horizon, and Jameson. She also holds board certification in integrative and lifestyle medicine, as well as mind-body medicine. She serves as the medical director for UPMC's lifestyle medicine program. She is also associate professor of family medicine at the University of Pittsburgh School of Medicine, as well as adjunct clinical professor at the Philadelphia and Lake Erie College of Osteopathic Medicine. She works at UPP Family Medicine and Lifestyle. Thank you, Dr. Michelle Thompson, for joining us today. I'd like to start off the podcast with an initial question of what AI tools have you already started using and have clinicians in the field already used that we may not know about?
Thank you for having me. I'm really excited to be here and talk about this because for me, AI in healthcare has been life-changing. I actually have been using a bridge, which is ambient AI, since the onset. And many people don't know this, but when it was built initially, I was part of, beta testing of it, and it was built at UPMC Enterprise. And so when it was being built, it was just listening to the conversation and recording the patient, and the patient would leave with it on their phone and take it home. And the patient was getting to be able to listen to that again on the patient-facing side, which was really great for the patient education so that they were able to say, what did the doctor say about my blood pressure or whatever it might be? You had to agree to be recorded and the patient's family could be listening and all of those things as the physician. But then we knew that eventually it was going to move more into tools that can help the physician. And so we started using a bridge for capturing the note. It is wonderful at capturing the HPI and the assessment and plan so that you can be more mindful with patients. So I was actually in the New York Times for talking about that because I think all too often we're buried in our computers trying to take notes and we're not completely present with our patients. And, as a DO, we want to touch our patients. You want to be free up from the computer. And so a bridge AI ambient has been very helpful for me to be able to really be a better doctor. It captures all of everything that I need it to put into the HPI and assessment and plan. And then I'm able to just at the click of a button, put that into my note and be done. It used to take me 2 hours to do notes. And now it's only taking me like 10 minutes. And I think the notes are better. It's not missing things like we might miss things. And I think it allows the students to be more mindful as well so that they can actually learn instead of them, trying to learn how to take notes and frantically be taking notes and not really listening and being present. It just frees them up to be more present as well. So I think overall that for me, from a scribe standpoint, has been really beneficial. And then you asked about what other things might we not be thinking about. And I use Copilot for meetings and capturing. I'm the director of lifestyle medicine for UPMC. So if we can't have everyone present, then we will just hit Copilot notes and it will record and transcribe everything in the space so that those who are not present can catch back up. And then even in making slide decks, I don't know how much you've used that for making slide decks. Pretty crazy. We used to actually manually have to do all of that, but it's wonderful. Just create me a slide on this and it puts all the information in there and you can tweak it. And that's been great. And then open evidence is another one that I think has been so useful for me to be able to just say, what do you think about this? I was running a brain health group medical visit for patients with family history of dementia. And the goal is dementia prevention through the group medical visits. And somebody asked me about Prevagen, the over-the-counter supplement that they could purchase. And I said, that's a very good question. Let's see what open evidence says about it. So I put it right into open evidence. And then I was able able to give the whole group information that's evidence-based with literature support to tell them about the pros and cons of consideration of that.
I definitely agree. I have used those resources as well, specifically via Bridge. We just started using that in our residence program about a month ago, and it's made a world of difference, spending more time with patients. Also, how concise the assessment and plan is, picking up on some nuances in the plan. And then the notes are available for our patients to review afterward as well. For some of those patients who like to talk, it won't give you a 2-page HPI, but it'll summarize everything in a nice and concise manner. Regarding open evidence, I use it every day. I have a tab open on my laptop while I'm in clinic. It's become one of my main sources of education and information gathering. I do trust the website because of its affiliation with the New England Journal of Medicine, Mayo Clinic, and a lot of other trustworthy and notable resources. So I have had the experience of working with some of those tools, and I'm in complete agreement. It saved hours and hours of time. As a third year, we're seeing sometimes up to 22 patients in family medicine clinic, and it saves literally hours a day, if not in a week. So I wanted to switch gears and maybe play devil's advocate, but AI is a tool, and tools sometimes don't work. So if there is a mistake made, let's say in open evidence, and there's incorrect information or something is transcribed incorrectly, who do you think is responsible for those mistakes?
Well, we as clinicians have to review this, right? So if you're putting your name on it, it is your responsibility to make sure that it's correct. But one thing that I want to mention, because UPMC has open note policy, I tell my patients in the beginning, this is going to be transcribed and the note is open and available to you. I encourage you to go home and read it. And please tell me if you notice any mistakes, and I will be happy to correct them, because no technology is perfect, right? And so I really utilize it as a, shared approach, because I think, what do we do best? Doctor means teacher. We're educating our patients. We want our patients to be able to look at those notes and have the information. To be honest, when we first had open notes, I was like, oh no, everybody's going to be saying, can you correct this? Can you correct that? It never happens, actually. Patients are really good about the notes and nobody's picking them apart. I did have a patient one day that fell down the steps. Like, the way it said it, it made it seem like she was clumsy as opposed to that she tripped and fell. And she asked me to correct the language, so it didn't seem that way. But that was just one particular incident. So I think we have to be mindful, but I think really just telling the patient to look at it and engaging them in their healthcare, that is going to be more helpful to us. We know when we put our patients in the driver's seat of their healthcare that the success is better, the outcomes are better, and, it does free us up a little bit from having to do all the legwork.
Right. I definitely think that initial warning is warranted, and it may help offset some of the hesitancy with using it. I haven't had a lot of patients decline or not give consent for using it, but there may always be some sort of doubt. So it could help letting them know at the start of the encounter. I also agree. I think as clinicians, we were trained to judge resources, find out where information is coming from. There's old literature that is outdated, that's replaced by newer literature, and it's a part of our lifelong learning journey to update ourselves on correct information. And at the end of the day, signing off on the note makes you responsible. So I agree. And I think it's worth emphasizing to users of these tools that, you still have to double check your work. We can't become too nonchalant and just sign off on whatever AI says until maybe the technology becomes more accurate and more foolproof. We're still in early stages, like you said, what was only started a few years ago with the initial versions, and I'm seeing newer applications every day. I would like to also ask about the way AI can reinforce education. You are involved in a couple of different educational training programs, and apart from Copilot that you mentioned you use for some transcription or slide formation, how else have you or your students reported using AI?
Well, I think they're dabbling in all kinds of, chat GPT and things like that, even just in their personal life and making plans to go somewhere and what's the most popular. And one of the big things I think is useful for the learners is thinking outside of the box and just looking at all the different resources very quickly, as opposed to back when I was in my residency program at UPMC Mercy, I had to go to the library. I had to physically go go to the library. Do you even know what that's like, a library, right? Like, I mean, gone is the day of the library. I moved from a library to having a Palm Pilot to having a cell phone, right? And now we have AI. And so I think we're quickly able to get information and then begin to sift through it. And I think, that's helpful for people to not have to do all the back end work of digging for it because it's right there. I think it's also helpful for them to be able to utilize it with their patients and talking about resources. Like, for instance, if a patient has cancer, you talk about cancer treatments, the medical student can look up the information and review it with the patients. Also, patient instructions, just giving patient instructions and saying, create new patient instructions on a lifestyle medicine prescription for eating healthy on a budget or whatever it might be. It can create things like that for you. So there's tools, handouts, group medical visit, platforms, structures, summaries. I'll give you, for instance, a meditation. I teach a lot of meditation and mindfulness. If I just want a quick meditation on like peace and compassion, I was just doing one recently. I had in my mind what I would say, but I just threw it into, AI to see what it would give me. And then I pick and choose, take what I want. It's like going to a buffet. You don't eat the entire buffet. That sounds good. And you go with that. So I think allowing the students to absorb at a level that feels right for them. And I think also, allowing them to be a learner and not have to be so focused on note taking. I remember when we had to write everything out ourselves, like handwriting. There's even that. I mean, probably didn't even do that, So I just think it allows you to be able to be a better learner and better at gaining the knowledge, and in a way that gives you a little bit of your self-care back, because it's hard to be a medical student and a resident because there's not a lot of time. You're busy. Your whole life is consumed with taking care of others and figuring out how to take care of others. But I think AI gives you the ability to take your life back into your own hands and have more time available for yourself as well. So just thinking about outside the box, how you can use those tools. There's a lot of ways. What thoughts do you have?
Yeah, it's similar thought process there with wellness. I think it may be one of the tools that answer the question of burnout amongst physicians and primarily residents and medical students who spend long hours, not just in the clinical setting, but then also the educational standpoint and examination preparation. My next question about rote memorization as well. I think those days are long gone. I'm seeing learners put an entire syllabus into AI and AI generating first and second order questions, multiple choice questions that they can answer and get feedback on the spot. I think with that time taken back from the more tedious tasks like the note writing or charting, and I think even some AI has started to address inboxes, which is the bane of any outpatient clinician's existence. So I think as we get more applications, we'll see that it is giving time back and allowing the learners to learn and not spend so much time maybe on flashcards memorizing, or also some of the formulas and specific disease processes and adverse reactions to certain medications. Those are all at your fingertip. And I think it is important to have a baseline understanding of a lot of that. One of the largest changes that I saw during my medical education was a transition from brand name medications to generic. All the new information coming out now, AI gets updated a lot faster than textbooks and journals. So I think it is the most up-to-date source. So I'm in agreement there. As far as becoming more efficient, we may have the expectation of becoming more profitable as well, especially in hospital systems where some of the justification for 20-minute or 40-minute appointments for preventative visits, appropriately getting a history, but also the documentation standpoint. Do you feel that AI may be taken advantage of in that regard for employed physicians, and we may see, instead of getting some of that time back for ourselves, having that time allocated to seeing more patients?
I 100% think that it allows us to bill higher because our notes are meatier and, there's more quality and substance in there. And we may not even add certain things. I didn't write down about the rash that I treated on the side or the runny nose that I recommended an over-the-counter medication for. And it captures all of that, which then allows you to have the increased complexity of the visit. So instead of billing a 99213, you may be able to bill a 99214, or the 99214 to the 99215. You may be able to go up to a 99215 just because, all of the things that it captures for you, that I have to say that historically, I may have missed things and didn't write them down. Back in the day, my doctor was like strep throat, amoxicillin. Those were easy notes back then. But then it became, we needed to have all these different levels in the HPI that we have to hit. And AI captures what we need. And the important thing is in plain language for the patient to understand it. So it captures it enough so that we as clinicians understand, but then for our patients to understand it. So I think it's beautiful because, you and I may say things that our patient may say, what do you mean by that? Because we're talking in medical jargon and they don't really understand it. So it takes the things we're saying and interprets it and puts it into all that is needed for billing, for, patient education, for clinicians to understand, etc. And we are able to get 2 hours back in our day. You can add on one more patient if you choose to, however you want to take that. So maybe you add in 4 more patients in your day, or maybe you say, you know what, I'm going to go to a yoga class instead, or I'm going to go out for a walk and I wouldn't have otherwise gotten to do that, or I'm going to eat dinner with my family, or I'm not going to sit in my bed and chart like I used to do, fall asleep in my computer and my charts, because that was what I would do. And I'm so grateful for that. And I do sit on the well-being committee, the Physician Thrive committee at UPMC. And that's when I first learned of this. They brought it to us to the Physician Wellbeing Symposium. And that's when I said, I'm on board. I'm trying this. And I never looked back. It has been truly life-changing for physician burnout and well-being, because I think we all need more time back in our day. We're all busy. We all need 27 hours a day to take care of patients, and we don't have 27 hours a day.
Yeah, I share that sentiment regarding the profitability and appropriate billing. I can't tell you how many times already using a bridge for the past month, I've looked at my note afterward and there have been at least 2 to 3 additional diagnoses that I hadn't planned on billing for, but that I addressed directly either through reviewing vitals or prior labs or the labs that I had ordered, and it does pick up on every little thing. I think appropriate billing helps the system as well as helps us with our understanding of billing as well. And it helps, make sure that you haven't missed anything either that you discussed, and it holds you accountable to the things you've discussed with your patient as well. Regarding the time back, I'd say as long as, there's some time preserved for the well-being and it has been efficient enough, I'd say most appointments I'm finishing in around half the time from beginning to end. So I'd love to see more patients, if that means keeping the resource to keep the visits more efficient, as well as the benefits of AI. It also comes with a downside. I have seen a lot of information out in the news and some of the concerns from aspiring physicians, medical students who are being told that AI is going to replace the physician and there may not be a role for physicians in the future. So I have had some patients come in with ChatGPT transcripts of questions and symptoms that they've asked, and they've been open to discussing that with me and still took my expert opinion into consideration and, came to a mutual decision on, all right, maybe we don't need that specific anti-inflammatory marker, but maybe we could try adjusting the dose of this medication. And I think the overarching theme here is AI has been implemented in medicine as a tool to make our job more efficient, to give time back for our well-being, to make billing more appropriate, to also help with our documentation clarity. I don't think it has replaced any large aspect of my job besides just making my job easier. There may be some conflict with non-patient-facing positions, I'd say, such as radiology. But even then, taking into account the patient's history, other factors in their care instead of just an objective interpretation of an image, I think is an art that radiologists are experts at. So I would say for the time being, I haven't noticed any threat to the job outlook for physicians and nothing but positivity from the implementation that I've experienced so far.
Yeah, I think you nailed it when you said the art of medicine. AI will never be able to recreate the art of medicine. And, we all can learn the science, but the art is the beauty in medicine. And I think mindful use of AI in healthcare is the answer. And so if we consider mindfulness in everything, I think that part is really important. Yeah, I've been so excited to have this conversation with you because I think that oftentimes physicians are afraid to try different things. And I would just encourage people to just give it a try. You never know unless you try. So I have a lot of information that's out there on my website, which is wholeheartedmedicine.org. I have resources on my website for information about lifestyle medicine, integrative medicine, AI, mind-body medicine, all the different things. And then also mindfulness practices as well. So, I'm really happy that you invited me to be here with you today. I love working with our medical students and residents and, attending physicians out there. And just hopefully we all stay happy and healthy, remembering to take good care of ourselves while we're taking good care of others.
I really appreciate your time, Dr. Thompson. And I think it is a very important new innovation in medicine. I feel that you have jumped on the boat early, and it's nice seeing that there are attending physicians already implementing it and are so pro AI. We see enough systems and maybe older doctors that don't like technology in general, and they like to stick with their old ways. So there's nothing wrong with that. They want to continue doing it that way. But I think with the rate at which medicine is growing and responsibilities of physicians are growing, we need every tool that we have at our disposal to try and keep some sanity in our lives.
Yeah. And I think that's the beauty, is putting just extra tools in our toolbox, right? And I come from the time where we paper charted and went to the library and all of that. So I think just, being up for change until the very end, I think that's really important for each and every one of us, because you never know unless you try.
I agree. Thank you so much. And thank you, listeners, for tuning into this episode. I'd like to thank you, Dr. Thompson, for your time and your takeaways from today's episode. If you have any feedback or any episode ideas, please email us at poma@poma.org, and be sure to subscribe to the POMA Does podcast series on your favorite podcast platform or POMA's YouTube channel. We'll see you next time.
Thank you for joining us for this edition of POMA Does. Be sure to subscribe to POMA Does wherever you listen to your podcasts, and tell your friends and colleagues to tune in. Learn more about osteopathic medicine and POMA on our webpage, www.poma.org, and join the conversation on social media. We're on Facebook, Instagram, LinkedIn, Twitter, and YouTube. Or email us at poma@poma.org. We'd love to hear from you. Join us next time for another edition of POMA Does.